All right, so we're going to be talking about an introduction to image interpretation, and this is on chapter 30 of your dental radiography textbook. So the learning objectives that we'll cover in chapter 30 are first to define the key terms associated with interpreting images, to summarize the importance of interpretation of images, to describe who is able to interpret images by defining the roles of the dentist and the dental auxiliary and the interpretation of dental images. And that dental auxiliary is just a term we use for dental staff. So anybody like a dental assistant is a dental auxiliary, a hygienist is an auxiliary. Also discuss the differences between interpretation and diagnosis. We'll describe when and where dental images are interpreted. We'll discuss the sequence for interpreting images, describe how interpretation is documented and how interpretation can be used to educate the dental patient about the importance and use of dental images. So the image interpretation is an essential part of the diagnostic process. And the ability to evaluate and recognize what is revealed by a dental image enables a dental professional to play a vital role in the detection of those diseases, lesions, and the conditions of jaws that cannot be identified clinically or in the mouth. And the purpose of this chapter is to present the basic concepts of image interpretation and to review interpretation guidelines. So as far as the basic concepts go, we'll go over interpretation of terminology as well as the importance of interpretation. And before a radiographer can inspect dental images adequately, a thorough understanding of the terminology and importance of interpretation is necessary. So to interpret means to offer an explanation, and an interpretation is an explanation, and an image interpretation is an explanation of what is viewed on a dental image and the ability to read what is revealed by a dental image. And the knowledge of these terms is important. So as far as the diagnosis goes, it is the identification of a disease by examination or analysis. And in the dental setting, the dentist is responsible for establishing a diagnosis. Other members of the dental team are restricted by law from rendering a diagnosis, so you will not ever diagnose a patient. Dental radiographers must be careful what to say within their scope of practice when interpreting dental images. In addition to understanding the importance of dental images, the dental radiographer must also understand the importance of interpretation. A great deal of information about teeth and supporting bone is obtained from interpretation. Consequently, image interpretation is of a paramount importance to the dental professional. Some of the guidelines include who interprets images, interpretation versus diagnosis, when and where images are interpreted, what is the sequence for interpreting images, how is the interpretation documented, interpretation and patient education. And just note there is a difference between interpretation and diagnosis. So you can interpret images if you have the proper training, but as a dental auxiliary, you will not diagnose. And the dental radiographer needs to be familiar with each. So training is necessary to interpret dental images. Any dental professional within training and interpretation can examine images. And both the dentist and the dental hygienist are trained to interpret dental images. The dental assistant, however, may or may not be trained in the interpretation of dental images. And the amount and scope of training in dental image dictate whether the dental assistant can perform image interpretation. And to interpret images, the dental radiographer must be confident in the identification and recognition of the following. So you need to know all of the normal anatomy, the dental restorations, dental materials and what foreign objects look like. You need to know what dental caries looks like, as well as periodontal disease. You need to know what traumatic injuries and periapical lesions look like, as well as some common artifacts and errors. And the dental hygienist and the dentist are taught how to interpret clinically. However, the dental assistant may or may not be trained. So there's a difference between interpretation and diagnosis. In the dental setting, the terms interpretation and diagnosis are often confused. And it's important to note that these terms have very different meanings and should not be used synonymously. Interpretation refers to the explanation of what is viewed on a dental image, whereas diagnosis refers to the identification of disease by examination or analysis. And in dentistry, a diagnosis is made by the dentist after a thorough review of the medical history, dental history, clinical examination, image examination, and clinical or lab tests. And although the dental professional with training in interpretation may examine dental images, the final interpretation and diagnosis are the responsibilities of the dentist. And dental hygienists and assistants are restricted by law from rendering a diagnosis. So when and where dental images are interpreted. So it is best to have images taken at the beginning of the appointment and interpreted immediately after mounting in the presence of the patient. If any suspicious or questionable areas are seen on the image, the patient can be examined by the dentist or dental hygienist to obtain additional information or to confirm the suspected problem. So just remember, it is important to remember that images are taken to benefit the patient. And when interpreting their images, you should do it in their presence. All right. So as far as the sequence of interpreting images, and to interpret a complete mouse series, the recommended viewing sequence is as followed. So you'll begin with the maxillary periapical image, view tooth number 1 on the upper left side of the mount, then move horizontally to maxillary right, and finish with tooth number 16. So when you read a dental image, it's sort of the same thing of how you would read anything, and that's from left to right. Next, you'll move to the mandibular right and continue with the mandibular periapical images. Begin with tooth number 17, move across to the mandibular left, and finish with tooth number 32. So it's almost like going around in a circle. You'll start with the upper right. You'll go to the lower, you'll start with the upper right, go over to the upper left, and then start again with the lower left and work your way over to the lower right. Then you'll move up to the bite wings and view the bite wings from your left to your right, as if you were facing the patient. So as part of a thorough interpretation, multiple examinations of dental images are necessary to check for all the problems just listed. For example, the dental radiographer should first view the images quickly for evidence of unerupted or impacted teeth. Next, the examination sequence should be repeated for caries, pulp size, and pulp shape. And when learning interpretation skills, a checklist can be used to provide yourself with an organized format to gather essential information that is needed prior to diagnosis and treatment planning. So all dental images must be reviewed and interpreted. And how interpretation is documented is it's supposed to be documented in the patient record and include the following. It should include the date of the exposure, the number and type of the images taken, the evaluation of diagnostic quality, the list of limiting factors, retakes, or additional images needed, descriptions of teeth. And when you describe teeth, indicate impactions, number of anomalies, crown anomalies. And what I mean by anomalies are just problems, things that look abnormal, defective restorations, caries, calculus, pulpal changes, root abnormalities, and other miscellaneous features. So interpretation must be documented, and it has to include the description of bone and supporting structures of the teeth, the description of artifacts, and any indication of any areas that require additional images or clinical evaluation or confirmation. And when you describe bone, and when you talk about bone in front of the patient, you have to be very careful not to indicate periodontal disease, because then you kind of straddle the lines of diagnosing. Anytime you talk about bone loss, you're sort of diagnosing bone loss on the patient. So you just have to be careful not to do that. But the things that you want to know and be able to communicate with your doctor or any other staff in the office, you want to be able to know what PA radiolucencies and radiopacities are, and we'll go over that later on, as well as bone loss and other anomalies like that. So interpretation of dental images can be used as an educational tool in the professional setting. In addition to providing a preliminary interpretation, the dental radiographer can educate the patient by identifying and discussing what is normally found on a dental image. Then the dentist can focus on specific problems or areas of concern. So educating patients through use of dental images can help everyone work together as a team. That's it for this chapter. Let me know if you have any questions. We'll talk soon. Thanks.